Okay. Just a minute. Excited to introduce to you tonight a young man that I have grown to like very much. I've realized that he is sincere. I have come to the conclusion after several visits to Sierra Leone and with his leadership at the Ministry of Health that we have a light at the end of the tunnel. We shall become the country that we were before he went to medical school. I happen to know this man when he was just appointed by His Excellency, the retired Brigadier Bill. And we talked. He graduated from the medical school in Sierra Leone, later went to Switzerland, and came to the United States and had a PhD. He's been working with various organizations, but most importantly, to work for Sierra Leone. This man that I know was on his official duties in Kailam district. And I said, look, brother, we need you to be here. How many Sierranians will you see? He drove all the way from Kailam to Cambia, to Conakry, and through to the United States of America, only to meet with us, to discuss our problems in Sierra Leone. He's also a professor of dermatology. He teaches at the University of Sierra Leone. And he loves our country. He loves his people. Under his leadership, when we made our last trip to Sierra Leone, we were given mobile buses. We were given ambulances. We had other physicians to work with us. And he stayed with us the whole while when we were in our meet and greet. He was so like it that he had his suit on for the whole day. Ladies and gentlemen, I want you to join me to welcome my brother, my friend, that I can depend on, that I can call every day. He will answer that call. Dr. Professor Charles Senisse, Deputy Minister, Republic of Sierra Leone.
Mr. DJ or Madam DJ, let me hear that song, please.
On that note, His Excellency the Ambassador, Excellency Honorary Consul, my brother, Chairman of the Healthcare Sierra Leone USA, Sir Pierre, and First Lady, and ladies and gentlemen, please permit me to stand on the existing protocols. Indeed, I'm extremely happy to be here. I'm lucky to be here this evening because, as the chairman said, I walked, I drove, I flew over many countries for me to be here this evening because I gave my word to Healthcare Sierra Leone. I believe in their mission and I believe in what they are doing. And I thank you all, ladies and gentlemen, for coming here this evening to grace this occasion. It's a pleasure for me. And on behalf again, as for protocol, on His Excellency the President of Sierra Leone, on behalf of the leadership of the Ministry of Health, and on behalf of the people of Sierra Leone, I bring you greetings. Indeed, most of us in the diaspora believe we have to give back to our continent and countries of origin. And I speak directly to the Sierra Leoneans who are online and in this room, and those especially back home. We have to redefine who a diaspora is, so that we don't have any differences that can be quietly creep between us. And I say this because I'm one of the biggest diaspora fans from the IOM designated, so we have to redefine that one. That if you are in Sierra Leone or here, especially for brothers and sisters in Sierra Leone, if you have ever darkened the doors of the West, or darkened the doors of countries outside Sierra Leone, and you go back home, you are a diaspora. You don't need to stay permanently in the West for you to be defined as a diaspora. And I speak directly to my Sierra Leoneans and to us Africans and low and middle income countries in general. Because that is one of the issues we have, that diasporas only need to stay out for you to be designated. No. I stand authority to redefine that, and I've said it all over. So we have that unity among us, that you can be a diaspora back in Sierra Leone if you've been out, maybe for a week or two, to do courses or study, because it's your decision not to stay in the West and go back home, like most of us have done. So we join hands together, it's important. And we are very happy, as I said, diasporans, we are able to contribute to our countries or continents of origin, so that at least we can bridge that digital divide, we can bridge that knowledge gap, that knowledge transfer and exchange. Is one of the greatest social legacies we can live upon. So I would encourage everyone in this room, be you a Sierra Leonean diaspora or friends of Sierra Leone diaspora, you have a role to contribute to Africa and to Sierra Leone in particular. I've been working for the past 30 years before I appointed running mobile clinics all over sub-Saharan Africa. I don't need to be a Nigerian, I don't need to be a Kenyan, I don't need to be a South Africa, a Zimbabwe or whatever. We all have the same problem that affects us. It's only the value, the magnitude that varies from one country to another. So therefore, we have a common identity. There should be any reason why we should not be united. Even for Sierra Leone, and even going to the granular level in Sierra Leone, be you from the East, West, Central, be you Zimbabwe, we all share the same identity. So there should be no reason, again, why should we all should not be united in bringing healthcare to Sierra Leone. At the end of the day, we look at the bigger picture. So having said that, I'm extremely happy that Healthcare Sierra Leone continues to take the leadership. And I thank our able ambassador for giving us such an inspiring speech tonight. Thank you very much, Mr. Ambassador. We have spoken so many times across so many issues, but this is the first time we're physically meeting, and I'm more than inspired by what you said. And we thank you for your support to Healthcare Sierra Leone in what they are doing. And Healthcare Sierra Leone has really contributed a lot to our health sector. I said I run mobile clinics all over Sub-Saharan Africa, and they will be collaborating very well, because at the end of the day, we look at the bigger picture. And I'm happy they are joining us at the Ministry of Health over the many years as we've been working. And because, they are becoming so diversified, very much true to that 1946-48 definition of health, which is that state of complete physical, social, and mental and social well-being, and not only the absence of disease and infirmity. They have actually diversified in so many areas that holistic response to healthcare delivery is what is very inspiring for us. And indeed, along this line, I must also say we at the Ministry of Health in Sierra Leone, we are also equally quite ambitious. And we know there are issues, like every low and middle income country in sub-Saharan Africa, we cannot get everything in one day, but we are on the way. And then I can also allude to the fact that some of our mortality rates used to be the worst in the world. 2014, 2015, the maternal mortality in Sierra Leone was about 1,500 or 100,000 life baths. And when we took over government, in about a year or so, or two, we have reduced it to about 60%, which is stood at 770, it was 443, 2020. But I can authoritatively tell you that maternal mortality in Sierra Leone now is around 300. It will be officially published, which means any more people are doing here is going to add up. And we are not done yet. We really want to go down by 2030. At least we should do like 50 or 100,000 life baths. And we have been challenged. By 2038, we should have zero mortality, maternal mortality in Sierra Leone. I tell you, if we can do this, if we can optimize on what we are working on here. And child health is a problem for us. We are making big gains on maternal mortality, but the fact is public knowledge that on child health we need to do more. So we have got a lot more focus on child health. We have created a special department within the Ministry of Health, focus a new program, focus purely on child health. We've got accelerated action now on child health. We are joining the leadership of the world, and especially the World Health Assembly, to make sure that we have pictures together with people around the world to make sure we make big gains on child health, and we are on the way. Maybe by next year when I stand here again, I'm sure we will make big gains because we are doing a lot of things to make sure that we improve on our child health in Sierra Leone and beyond, which will be like a replica for low and middle income country, including Sierra Leone. Having said that, I think healthcare Sierra Leone is working very hard. But where are we? What plans do we have in Sierra Leone for the healthcare delivery system? And we have redefined again healthcare, which has won us great admiration in the sub-region and beyond. In that we look at healthcare from that life stage model, which means from conception to senior citizen. We want to address all the factors that affect the individual or patient along that journey of life. And this is deliberate because we have lots of programs that are only vertical. We only look at infectious disease in vertical line, we look at chronic disease in vertical line. We want to say we address all the issues that affect the individual. And that model has been very much, we can have copies sent out. Lots of countries want to copy that model, so that at least you look at that holistic view of healthcare delivery in Sierra Leone. And then when we can lay this further, we have key domains we are focusing on a lot, which people coming to Sierra Leone, the diaspora, friends of the diaspora, donors, development partners who actually align with us. We look at the primary healthcare. We invest about 80% of our time on primary healthcare in Sierra Leone, bringing healthcare as close to the people as possible, and we are very deliberate in doing that. What we also build upon is secondary and tertiary healthcare. There we have to be bigger gains, and I'm happy our ambassador has pledged to work with Healthcare Sierra Leone to build the state-of-the-art hospital in Sierra Leone. We need to do a lot more of that.